Support comes from Hampton Roads Community Foundation, partnering with donors from all walks of life to improve southeastern Virginia through grants, scholarships, and leadership initiatives. Learn more at hamptonroadscf.org.
Hello everyone, I'm Lisa Godley. February is Heart Health Month. So on today's Another View on Health, we'll be talking about heart disease. It's the #1 killer of adults in the United States. We'll also explore the #5 killer and the leading cause of disability, stroke. For Black people, the risk of having a heart attack or stroke are higher than any other racial or ethnic group. But there is good news. You can make smart changes and dramatically lower your risk. Coming up next on Another View, cardiologist Dr. Keith Newby is in the studio, keeping it real about your heart and your health. Stay tuned. Another View will be back right after this national, regional, and local news from NPR and WHRO News.
Discussing today's topics from an African-American perspective, this is Another View.
Good afternoon, everyone, and welcome to Another View. I'm Another View producer Lisa Godley in the studio for Barbara Ham Lee. Barbara is under the weather today. In fact, she said it was okay to share that she'd been to the doctor and tested positive for COVID, the flu, and has a sinus infection. So we are praying for her speedy recovery because that's a lot to take in. We also are waiting for her to get healed and ready so she can be back in this chair next week. So, Barbara, get well. Now, before we delve into today's conversation, I want to tell you about an important conversation that ODU is hosting. It's the Hidden Haven of Triple-Negative Breast Cancer and Women's Health Fair on March 22nd from 9 until 3 p.m. and will take place at First Baptist Church, Lambert's Point. Triple-negative breast cancer is a particularly aggressive form of breast cancer that disproportionately affects Black women and has limited treatment options. And Hampton Roads has the highest rate of this form of cancer in the nation. So mark your calendars for March 22nd to be a part of this important conversation. Well, it's nice to be back with you live after our snow hiatus last week, and it's especially good to be here with our favorite cardiologist and my brother in Greekdom, Dr. Keith Newby, who has his own practice and also serves as the Market Director of Community Health Improvement and Engagement with Bon Secours. Boy, that's a title.
Yeah, there you go. How are you doing today?
I am doing great. Wow, Heart Health Month, so much to take in, so much going on.
Yeah, well, you know, I'm always in my element on Heart Month.
I know you are. The one thing that really stood out to me, Keith, when I was researching, trying to make sure I could present this well, was this Cleveland Clinic study that said 3 out of 5 Americans admitted to skipping their prescribed heart medications.
Yeah, I'm going to tell you, like when you mentioned that to me earlier, I said only 3 out of 5 because that's probably all that admitted to it. We deal with that like all the time. Compliance is that's probably one of the biggest issues we run into is getting people to take their prescribed medications. It's a multifaceted problem. And it's just people just don't want to take medicines. You know, I get that all the time. And I'm like, well, you brush your teeth every day. You know, I keep forgetting, or I just don't think about it, or I don't want to take this medicine for whatever reason they come up with. And I'm like, yeah, but this stuff's keeping you alive. And, you know, really, when you really think about it, I tell people all the time, I say, either you take the medicine or you change your lifestyle. And that's where you'll find in this country, the biggest issue is what we do, what we eat, how we behave, the stresses we have, lack of activity or exercise. All that can play such a significant factor in our health. And, you know, medicines are just an add-on to me on what we're supposed to be doing anyway. The problem is we try to use it either as a substitute or make up some excuse not to take it. Hence, that's where we run into a problem. Because I guarantee you, I mean, I always like when people come in the office, and I always tell people to bring their medicines with them because I want to see them. And they always say they bring a list. I'm like, I don't want to see your list. I want to see the actual bottles themselves because I'm counting pills, because I can look at them and tell. Because I got somebody that brings a bottle in that's like was filled in June of 2024. Still got 45 tablets in it. Supposed to be 60 in the bottle. And I'm looking at them like, okay, tell me this February. How does this work? Oh, I just take pills from my old bottle and put them in this one. I'm like, yeah, but why you have pills in the old bottle? They're supposed to be gone too. So I said, how is this working that you're taking this every day yet you got a bottle full of medicines that's 6 months old? I said, come on, you have to be upfront with me, taking care of you, and telling me an untruth is not helping you at all. So that's why I want to see them, but that's why they try to avoid bringing them in to me because they know I'm going to count those pills.
Now, according to this study, almost 60% said they simply forgot. To me, that seems like that would be as simple as setting an alarm on your wrist.
That's the excuse.
Okay.
That's the excuse. I mean, a lot of it, it's really what you value, to be honest with you, because I'm going to tell you, if Beyonce was in town and you had tickets to that show, you're going to remember to go to that because you probably paid several $100s to get there. You're going to remember. You remember things you want to remember. And that's really what it boils down to is what we value in our lives says what we do.
Well, what about that 11% that says medication is just too costly?
That I could believe. 11%, that sounds about accurate because most of the meds we use, unless they're brand name drugs, most of them are not that expensive. It just depends on what it is. In our world, we try our best to prescribe medications that are, a little cost effective. I want people to have the best of what we can offer, but it's sometimes you got to go with brand name drugs, but you try your best to avoid it if you can. But one of the things I do, I want to make one broad statement to everybody listening. Contrary to what anybody thinks, we as physicians do not get kickbacks on medication. I have never gotten one, never going to get one, never asked for one. That doesn't work that way. We don't make money off of prescribing a medication to a patient. That is one of those rumors that you hear. I mean, we really try to do the best work, looking at the data, what does the literature say we should do and how we should do it, what meds are prescribed based on that condition. So I always try to tell people that if you're trying to reduce the number of pills, let's change the dynamics because that really, you'd be surprised how your lifestyle will impact your blood pressure. If you're overweight, you're obese, or say your diet is high in sodium, that's going to get you in trouble. But changing that lifestyle, you could drop your pressure almost 15 points just on lifestyle changes. You go from 145 to 130, in terms of a systolic blood pressure. But it requires diligence. And it's not easy because of just the way society is set up. You turn on TV, you see a fast food commercial. You go to a store, everything's ultra processed. What we eat is how we live, and that's the problem. But I don't blame people for that, meaning the individual, because they don't know a lot of times. They don't realize what's happening. But I do believe that to be true based on the current literature.
Okay, so how are things interconnected? Like your blood pressure to your heart or your heart to a stroke or...
Okay. So think about, I tell people all the time, if you think about the heart, now I give a lot of analogies when I'm teaching patients, and I think that helps them relate to everyday life. So look at, and I use this a lot, look at your heart like a house. Your house, you have your floors, ceilings, walls, rooms. You have doors to open and close. You have plumbing. You have electrical. So the heart is kind of the same thing. Each room in your heart is your chamber, and you have heart valves, or like doors to open and close. The door needs to open fully and close fully. You have your plumbing, which is like your coronary arteries that supply blood to the oxygenated blood to the tissue of the heart. And then you have your electrical circuits, that's how the heart beats. So each component can work independently, but they have to work in conjunction with each other to allow your heart to do what it needs to do. So when you think about, say, somebody has hypertension, essentially that's a high pressure load in your vessels. So the main aorta has to transmit blood to all the tissues, your organs, and all that. So the heart has to generate a certain amount of pressure to push that blood forward. So if you think about it, and I try to use this analogy, if you think about if your pressure is high, the heart has to generate this extra pressure pushing blood forward. So think about, why does the heart enlarge? A lot of times from hypertension is because that high pressure load that's in your arteries, the heart has to generate more pressure to push blood forward. So the heart is a muscle. Like any other muscle, you make it work harder, what is it going to do? It's going to start to grow, just like people that lift weights all the time. The muscles in their arms get bigger because of what they're doing, how much weight they're lifting. So look at it like that. The higher the pressure, the more the heart has to work. So when people get an enlarged heart, a lot of times you can track it down a lot of times to things like hypertension. The downside with hypertension is because most people don't feel it. It's usually an asymptomatic illness, majorly. A lot of people think, I check my blood pressure when I get a headache. That's not, typically most people don't feel any of that. You got a headache probably from something else. Your pressure just happens to be high. You checked it then, but that doesn't mean when you don't have a headache, your pressures are fine. These are those rumors that we have to continuously dispel. So that is how the heart works to deal with blood pressure or hypertension. So that's why we need to get those pressures lower. Now, when you think about what is a normal blood pressure, because that's the other thing that impacts heart, a lot of people will think that a blood pressure like 140 is okay, but that's way too high. That's stage 2 hypertension. So an elevated blood pressure is if your top number is 120 to 129, that is considered an elevated blood pressure. Stage 1 hypertension is if your top number is between 130 and 139 and your bottom number is between 80 and 89. So either one. So if it's 134 over 60, that's stage 1 hypertension. If it's 110 over 84, that's stage 1 hypertension. So it's either or. So stage 2 hypertension is 140 or greater on the top number or 90 or greater on the bottom number. So why is this important? Because, again, people with untreated hypertension, that go on and skip the medicines all the time, 50% risk of developing heart failure within 5 years. Wow. 50% risk. 40% risk of stroke, 40% risk of kidney failure. So how does that impact our community? Because you think about it, going to any dialysis center in Hampton Roads and see who's sitting in there on those getting dialysis.
Mostly us.
Oh, vast majority, probably 99% is going to be us. I have very few white patients on dialysis. I had a whole mess of our folks on dialysis, and this is the part that, and it sneaks up on you. And that's why I kind of tell people, that's why it's good to go to your doctor regularly, because you may not know you have hypertension. And we're seeing a lot younger population. We saw it younger anyway before, but we recognize it more, and trying to get young people to say, I got to make these life changes. It's not easy, because in their minds, they're always going to be healthy because they're young. But I got a lot of 20-year-olds on dialysis behind hypertension.
Wow.
That's the point. So that's that issue. And, of course, diabetes. And, of course, interrupt me if you need me to stop at any point in time.
Well, I'm thinking of these young people that are on dialysis. What is it diet? Is it weight?
It's all the above, but it impacts. Each thing has a factor. When you think about what causes hypertension, a lot of it is, there's some unifying factors, and one big thing is obesity, being overweight. That impacts hypertension or blood pressure, and it raises blood pressures. And then a lot of times you'll see people develop diabetes who are overweight. Then you may hear this term dysmetabolic syndrome. That's like a conglomerate of central obesity, hypertension, diabetes, cholesterol abnormalities. All that leads to the potential for heart disease. Heart disease is still the number one killer. It outdoes COVID, outdoes flu, outdoes cancer rates, everything. And a lot of it is based on our life. Now, we could change that, but it involves diligence and really dedication and perseverance to changing your life around. So that's kind of what we run into, is how do you get people to take it seriously? And I know it's not easy when you feel good, generally speaking, and somebody says, take this medicine every day. And I give you a thought to that. Say like if you have an infection and you feel bad. Somebody says, take this antibiotic, give you a 10-day course of amoxicillin, and you're going to feel better. So say day 4, you feel like you're back to your normal. Will you continue to take it for the 10 days they gave it to you? Or will you stop it, which most people do, when they get to that stage where they feel like they're back to their baseline. And they'll stop it thinking that everything's done. The problem is the infection may be controlled, but it's not eradicated. So they give it to you this day to make sure it's totally eradicated so it won't come back. And a lot of people would take it a certain length of time, but not what's prescribed, and they'll just go on about their way thinking I'm fine, but then it may return back. So that's where that compliance of medication comes into play. And it's hard when you feel good to take a medicine every day. I get it. I understand that dilemma, because if you feel well and you say, somebody's telling me I got to take this pill every day, and it's like, but I feel good, and I know it's a conceptual idea that a lot of people have difficulty dealing with, and I understand that, and I respect that. But the problem is you will feel good up till when you don't feel good. And the problem is if you don't feel good because something major has occurred, some cardiovascular event or whatever, then you're really not going to feel good. And that may be a permanent not feel good. So that's why I think, I'm convinced, that's why heart disease is so prevalent in this country, especially because the illnesses, and you think about what are the things that lead to heart disease: hypertension, diabetes, cholesterol problems, obesity, lack of activity, family history. Those are like your big ones that you think about. Do you really feel bad with hypertension? Typically, no. Do you really feel bad with diabetes? Typically, no. You can, some people like you, extremes, you can. Extreme low glucose, extremely high glucose, but characteristically where most people live, especially type 2 diabetics, they generally feel good. They don't have any of these symptoms. You don't feel a high cholesterol. So, and I forgot smoking, of course. I left that out. But, when you think about, trying to change your lifestyle to the point of reducing your risk, the issue becomes following the guidelines, following the recommendations in a situation where you feel good. That's hard for a lot of people. So I respect that part, but I bring this up here because I think it's important for people to hear this, that just because you feel good doesn't mean you are good. And the issue becomes, if you continue to put it off, you miss your doctor's appointments, you don't follow, the rules like the dietary restraint that we ask you to do, you don't follow exercise regimen. I mean, I fight with people all the time with that, trying to get them to do, simple walking is helpful. American Heart says we're supposed to be walking 30 minutes, 5 days a week, minimum. So, and, somebody say, I walk at work every day. I'm like, yeah, but you're starting and stopping every 5 seconds. If you go up the steps and you go up one flight of steps, you think you did something. I'm like, I'm glad you're doing that.
If you haven't done anything else at all.
Yeah, but that's not enough. It's not enough. If what the goal is your health and it be a positive situation, you got to do more. So that's the thing. And I said, because think about it, you have to train your heart to be efficient. What happens when you exercise is your body, you're putting yourself through, your catecholamines are working. So typically your systolic pressure rises, your diastolic drops because that catecholamine responsive activity is helping train your heart to be more efficient, because that's really what you're looking for is efficiency. If you start to do that, and it takes time to do that, so that's why they give you a time frame. But if you say you walk 10 seconds and you stop, your heart says, okay, I'm getting ready to do so. He stopped. Okay. Then he starts walking, okay, we're going to do some activity this time, then you stop again. So you're not really getting the true benefit. It's better than doing nothing, but what you're trying to achieve, you're not going to get unless you're more active.
Okay. This says take a 10-minute walk. Is that long enough?
No. 30 minutes. I walk to the hospital every day.
We know you
every
stay
day.
on the road.
Listen, I was walking in the snow, last week, and that was a hot mess, but I did it anyway. Now, I ain't gonna lie, I had a couple of degrees of regret. Walking in snowshoes 3.5 miles wasn't easy, because I walked from the house, and I did that because I ain't trusting everybody on the road. People can't drive, and then they were driving crazy in the snow when there's ice on the road. So I said, let me just walk. And I just took the back streets. But I do that because, again, I have to lead by example. I'm not going to sit there and tell you to do it. I'm not doing it myself. So
okay. I got a question for you.
Sure.
The questions are starting to come in.
Okay.
I've heard people say I don't want to take that blood pressure medication because I know that affects your kidneys, and I don't want to end up on dialysis.
It's going to affect your kidneys if you don't take it.
Okay.
This is the thing. A lot of people have a misconception about medicine. The medicine is not going to destroy your kidneys. Now, there are situations, say as an example, and I tell people all the time to make sure you have a home blood pressure machine because you really need to check them at home. People get white coat syndrome where they come to the doctor's office and their pressures are high, but at home it may be totally normal. The issue becomes if you don't check them, we don't know. So all we could go on is what we see in the office, and that can be a mistake. So if we drop your pressure too low with medicines, yeah, your kidneys can act up then, but it's not the medicine's not causing it, it's your low blood pressure causing it. But you think about what happens. If I take, say, a water hose, and I have the little handle on it, and say I push it down full force, and I point it to one section of a wall, and I just let it sit there. Eventually, I'm going to dent that wall. That's what's happening in your body when that high pressure is like pushing that water hose, and I'm focusing on one spot. So you think about it. If I dent a wall, I can dent an artery. If I dent that artery, that causes damage, which causes atherosclerotic plaque formation, which leads to cardiac events. So think about that force hitting your kidneys constantly. 160, 170 blood pressure, and it's constantly pushing on those kidneys. Kidneys are like, dude, back off, and you're not backing off. So eventually it's going to start to damage that vessel, the kidneys themselves. So it's not the medicine itself. It is a situation, but the medicines themselves may actually protect your kidneys more than anything else if the pressures come down to a safer range.
Wow. Okay. Next question. Besides the obvious sugars and starches, what are the other real no good foods?
Take your pick. So this is the problem. And the issue, and the only reason I say that because, I didn't do my public health degree. Fortunately, it's my last year, finally. But in the event, I'm doing global nutrition class right now, and my eyes have been open to understanding how this country works. The packaging, processing of foods impact outcomes, because they're really kind of it's taking all the nutrients out of stuff, and all these processed foods we're eating is causing us to, have these medical issues. So really, I tell people, really try to focus on less packaged things. Just really go back to the basics. Start growing your own food. That's, what you got there. I know it's not easy for everybody, but they got these contained gardens now. You can do all kinds of things and grow your own food. And I tell people all the time, that's the best way to do it. But don't put a bunch of bacon grease and fat back in it. Because you kind of you tear apart all the good stuff that's in that. You have to figure out. I tell people all the time, look at different seasonings. It doesn't have to be salt, but there are different ways you can season your food to make it still taste good, but yet not kill yourself in the process. That's where you have to really take that time to look at how you're living your life and read, but be careful what you read. People would tell me all the time, I know this. I've done my research. I'm like, but you don't know anything about medicine. To really, when I say medicine, I'm talking about the field of medicine. To really understand what you're reading. That's like me giving you advice on finance. What I know about finance, I didn't go to school for that. I spent 17 years to do what I do. On top of the time, I won't say how long I've been doing this because that's going to tell my age, but I'll just say it's been a minute. Doing this every day. You read something for 5 minutes, all of a sudden you're an expert. I'm like, that does it. You have to understand whether or not that was accurate data that you read. How was that study designed? What was the nuances of it that you have to be able to analyze it to say, was this a good study that was done? And if it was, great. But if it wasn't, you're making decisions that may impact your life or your family's life.
Yeah.
Earful, isn't it?
It is. It's a lot.
I'm looking at your eyes.
Is there a disparity between someone's actual age versus their heart age?
Well, it depends on how you lived your life. Say if you were smoking like a chimney all your life and you had blood pressure problems, you ate bad, and you're, 200 pounds overweight, and your heart's going to say, something, I'm done. But but if you live your life right, you do all the right things, you can age appropriately with your heart. And I tell people all the time, sleep apnea, which I deal with quite a bit. A lot of people blow sleep apnea off. I don't know anybody that doesn't know that's when people intermittently stop breathing at night when they sleep. That can cause heart problems. I see it all the time. And I diagnose more sleep apnea, just send them for sleep studies. And that's been a big issue, getting people to understand how that impacts. Because think about it, you stop breathing at night, your oxygen levels drop. Your heart don't like poor oxygen levels. So the transmitted oxygen to your body, and that's why people get forgetful when they have sleep apnea a lot of times, or untreated sleep apnea, because their brain is getting deprived of oxygen at night, and that impacts. It causes accelerated dementia rates.
Wow.
It can cause all this stuff. Cause the heart to cause heart failure. It can actually accelerate diabetes as well, and it definitely can accelerate hypertension rates.
Oh my goodness. If you're just joining us, it's Another View on Health with cardiologist Dr. Keith Newby. Today we're talking about heart health. Please join the conversation at 757-440-2665 or 1-800-940-2240. Wow, it is a lot to take in. I pulled this and I want you to comment on some of these and tell me what you think. 5 ways to love your heart from the CDC. They say take a 10-minute walk. I know you said longer.
Yeah.
Eat an extra fruit or vegetable per day.
Yeah, I think, all this has to be taken into context. It's like a program you have to do. I agree with the extra fruit and vegetable, but if you do the extra fruit and vegetable, then go to a fast food joint. You kind of, you're not really. It needs to be the program itself. You think about it. You want to eat better, less processed foods, more. The fruits and vegetables are very important, but be careful about the fruits you eat, because certain fruits have tons of sugar in it. Bananas, mangoes are like the highest sugar fruits there are. Grapes right behind it. The good stuff in life, but you think about what the better ones are, like the berries, raspberries, blackberries, blueberries. They have a lot of, I think, fiber and something else. I forget what they have, but I know it's lower in sugar too. So those are the better fruits to have. And on the vegetables, you just want to make sure when you fix them, prepare. You don't want to like sog them, cook them to the nth degree. You want to, have a little bit of crispiness in it, because you want to keep those nutrients. If you boil them all out.
Yeah, you're definitely talking to me, because I do. I'll boil them to death.
Oh, Lordy. Okay. I have my wife talk to you. She knows how to do all that stuff. I'll make sure I hook you to.
Thank you. I appreciate that. Okay, the next one is don't drink your calories. It says drinking 12 ounces of sugar-sweetened drinks or sports drinks daily can increase coronary heart disease.
Yeah, well, you think about it, what is that doing? The sugary beverages, typically it's going to be processed sugar in there too. So, that stuff really can accelerate. It's what it causes. It increases your risk of heart disease, and that's through what that sugar does to your body. It's not the drink itself is what the drink causes as a result of you taking it in. You really avoid, water is the best thing. I know a lot. Listen, I got to struggle sometimes. When I'm thirsty, water's great, but it's like if I'm not, just to drink it, it's not easy to always do that. So I get it, but you want to be careful what you're adding to it, and this the artificial sweeteners, they have their problems, you really want to just go basic, that's the best thing for you. So but the sugary beverages, and I'll tell you that global nutrition class, I was looking at the rates of obesity in Jamaicans. If you look at Jamaica's increased their obesity rates like 800% over the last 20 years. Why? Because they're importing foods from here. They're not growing stuff over there like they used to. So they're a big importer, and they're getting the stuff we're eating here. And that's created a bunch of problems with diabetes in Jamaica, where it wasn't there before. That's what I'm saying, is what we do impacts so much as to how we live.
Wow. Now, this one kind of stood out to me because I was like, It said, wash your hands. And it said, washing your hands is something that you should be done regardless because of your heart health. However, washing your hands is exceedingly important if you deal with heart issues. Keeping your hands clean can help prevent the flu, pneumonia,
Yeah.
COVID-19, and other illnesses that have an effect on your heart.
Yes. That's an indirect approach. It's not a direct impact on the heart, but it's indirect, because if you do get infections, because you really can't afford. That's why they kept talking about if you have chronic illnesses or pre-existing conditions. That's when that COVID came out. They kept talking about that. The issue becomes is if you have a pre-existing condition, if it's heart disease, if it's, if you're a cancer patient, survivor, and you're still on chemotherapy, if you have like things like lupus, rheumatoid arthritis, drugs that they have to suppress your immune system, that means you're more at risk to getting infections. And these things can impact your heart. That's why I've had a couple of people die of flu recently. This is the first time I've seen deaths from the flu in a minute. And the flu's been kind of rampant lately. But that goes back to, how we live. And if our immune system is impacted, it can lead to that.
Yeah, there are vaccines for flu,
There's some vaccines for
COVID,
everything.
now pneumonia.
Yeah.
I'm like, okay. All right. The last one was count your blessings, saying think positive, and it could improve your overall health. Your thoughts?
Well, that's true. I mean, I'm in church all the time because, to be honest with you, I mean, I found my faith has really, it changes your whole outlook on life, and that I do think there's data that says about people that have positive outlooks on life do better, and I'm a firm believer in that. I think just how we, I give you an example. I'm throwing a plug in here, so just let you know. But,
here it comes. Okay.
Yeah, so our church, my church, First Baptist Butte Street in Norfolk. So we have a 225th anniversary coming up in this year. And, I reached out to, I'm throwing a plug in there, but we were looking at trying to get another pastor coming down just to speak. And the one they were trying to get, they couldn't get it because there was some issue with the schedule. And I talked to my pastor. I said, listen, I'm a big Donnie McClurkin fan. I said, let me see if I can't get him. You mind if I reach out to him? So I called I had never met him before. I hadn't talked to him before, but I love his music. I listen to it every day. I mean, literally, when I'm doing my walks in the morning, I'm listening to gospel music going to the hospital, and it changes my outlook. But people that are really, if you could feel the passion of their spirit when they're talking to you, it really touches my heart and makes me feel better. So I reached out to his staff, and I was able to get him to come here in July.
Okay.
So I say all that to say that, when you have, and I did that because of my Christian belief, and this guy has touched a lot of people. So I try to pass that on to other folks if I can. So if you can get people thinking about the world differently and kind of, we've become somewhat of a selfish society, I've come to be convinced of, but I want to get people back to thinking about other people. How do we manage our lives? And if you have a Christian belief or whatever you believe in, but it gives you that positive outlook, it can positively impact your cardiac condition.
Gotcha.
One of the things we haven't talked about is symptoms, signs, symptoms, and what are the different types of heart disease. I do want to mention that really quickly. So when we talked about the house kind of analogy, so you think about what are the different things you can have. You think about that structure of your house. If it's faulty, your foundation is faulty, you could think about that like heart failure. So your heart can there's different forms of heart failure. Systolic heart failure, diastolic heart failure. And that means that either the heart's weak or it's stiff. And people with hypertension can develop a form of diastolic heart failure, and they could go on to systolic heart failure. But when diastolic heart failure is when the heart's stiff. Heart has to do a couple of different things when it's reacting. It has to be able to squeeze and push blood out, but also has to be able to relax and accept another influx of blood. But as the blood gets to the top, you have to have a maximum output to get blood everywhere. So the heart has to be able to expand and then contract again. So if your heart gets stiffer, it can't expand well. So it can maybe, like say, an example, when you're walking, the heart has to do a couple of things. It has to be able to pump faster. It has to push blood out faster. But think about it. If the heart has to fill and then contract and have blood come out of the chamber, it has to be able to fill fast enough to do that. But if the heart's going faster, it doesn't have time to fill from the previous beat. So it has to be able to take more blood in. So it has to be able to expand more. So the heart can't expand when you're walking faster. It can't fill as readily, and that's when people would get short-winded when they're walking. Now, there are other things that can make you short of breath walking. It's not just heart stuff. But that is one of the signs of diastolic heart failure: shortness of breath with activity, swelling, things that can lead to heart failure. So the heart could be either weak and not pump out effectively, or it could be stiff and have difficulty getting the amount of blood out with each beat it needs to do. So either way, it can have similar symptoms. So you have heart failure, that's one. Coronary disease. If you have, say, the water pipes, cut on your faucet, you expect water to come out full force. If you cut on that pipe or that faucet and only a little bit comes out, or it's not with the level of force, that means there's something compromised in that flow.
Is that when people have to get stents?
Yes,
Okay.
oftentimes. So if people that may develop symptoms of coronary disease, like chest discomfort, like to get tightness, squeezing in their chest when they walk, they stop, it goes away. That sounds like coronary disease symptoms. When you, so sometimes we have to do like EKG, stress testing, things that will let us know whether that the person has a heart issue or not. That may lead to a heart catheterization, where we go and look at the vessels and see, do you need a stent? Okay. And the one thing I want to caveat, and I know this is a lot of information I'm giving, so I'm trying to be careful with how much I give, so I don't want to confuse people. But, the way this stuff works is somebody comes to the office and they say, I have a chest discomfort. We as physicians have to do a couple of things. We have to do a thorough history and physical. So we have to hear what the story is. What is it? What's your risk that this could be a heart? So we have to assign a risk in our minds prior to doing any tests. At least that's the way you're supposed to do it. Is you listen to the story, you do the physical exam, you look at the person's history. What are their other medical conditions? What's the likelihood that this person has heart disease? So you assign a risk, and then based on that risk, that's when you decide what test you need. If somebody who's 18 years old comes to me with chest pain with no physical findings and nothing there, the likelihood of them having coronary disease is almost zero at 18 years of age, statistically. Other people either may fall into what we call an intermediate risk, where they say, okay, they could have a heart, but we're not sure. You don't want to do invasive testing in everybody. So we say, okay, this is the kind of person you may want to do a stress test on, which is a treadmill exercise test, and see, because you're trying to mimic that water pipe going out and how much there may be compromised flow. High-risk patients that you say, oh, man, this story is just too much. It sounds too much like heart problems. I'm going to go invasive with them, because if I do a stress test on that person and it doesn't really show what I wanted to show, I'm still going to I still think that person has a problem. If they go out and have a heart attack because I'd say, oh, the stress test was fine. I really didn't do my job well. Data, you follow the data and the guidelines. If you have high-risk patients, invasive testing may be the better approach with them. Intermediate risk, you do testing, like stress testing, whatever. Low-risk patients is just reassuring them that it's very much not going to be a heart issue. So we have to take that relative risk based on how the story sounds to say, okay, yes, you look at everything together. It has to be a big picture. Risk factors, their story, their physical findings, and that helps you decide what's the next thing to do to answer their question.
Now, every now and then, we don't hear it that often, but we hear these stories about these young athletes. Mm-hmm. Oftentimes, they're some sort of ball player,
right.
And all of a sudden they have this massive, something. And it's like they're young, and
well, some of those things could be congenital disorders, things like long QT syndrome, hypertrophic cardiomyopathy. But a lot of times you can hear a murmur from a hypertrophic cardiomyopathy patient, which means that's like what you hear, like some of these ball players drop dead, when they're playing sports. But when you think about it, the issue is, I try to reassure parents, don't just, it's kind of like the news media would sensationalize something happening because they think that's newsworthy, which it is. But you think about the number of kids playing ball every day. I mean, that's a fraction of the people playing sports. I just tell people, if you have a family history, that's why it's important, especially in our community, that you know your family history. A lot of times we won't talk about this stuff. We will,
You're absolutely right.
we kind of put it off to the side. But the problem is, those individuals, if you have a family history of something, and people need to know, if it's a cancer issue, if you have a history of sudden death in the family, grandpa died, but he was only 50 years old when he died. That's a problem, and then why did that happen? If grandpa died, he was 95. Because, that person's life is going to be compromised anyway just because of their age. But premature deaths, those are the kind of those red flags you want to know. That can prompt you to say, okay, let me get everybody, kind of evaluated to make sure that we know exactly what their conditions are. Because you will find some people you will discover have one of these conditions. So knowing that family history and making sure you're at least getting an evaluation done. If you're going to go run a marathon, if you've never run one before, you're not going to just go do it. You want to be evaluated by your doctor to make sure you can do it safely. So these are just the things that we try to look at. Palpitations, a person has atrial fibrillation, which is a big one we see a lot of, and that's when your top chamber is beating irregular and fast. Some people develop palpitations from that. Now, everybody who has palpitations does not have atrial fibrillation, but this is where you want to have the evaluation done. If you have hypertension, you have a high risk for atrial fibrillation. If you have sleep apnea, that's a high risk for atrial fibrillation, which can lead to a stroke. So that's kind of the things you want to know is what's your history. What's the likelihood that you have some medical condition that can lead to some cardiac event that you don't want it to lead up to? So understanding that piece helps you make those determinations.
Wow. And you talked about this stroke, and I wanted us to kind of address that because that's something that you hear a lot of, particularly in our community.
So strokes, and a stroke is a form of heart disease, just so you know. Because if you look at the definition of heart disease, it's anything that affects the heart or the great vessels. So the vessels that supply blood to the brain come off of the aorta, and that comes off the heart. So it is a form of heart disease, but it's affecting the brain. So we think about what causes strokes. You can either have a thrombotic stroke, embolic stroke. Thrombotic is when you have a clot, that occluded a vessel, but embolic is when you have a clot that flips off and goes to the brain. And some people would just have an intracranial hemorrhage, and that's why hypertension is important, because you know where your blood pressure is, because those are the people with very high blood pressures that risk bursting a vessel in the brain, and they could cause a bleeding there. So that's why it's important to understand what is your relative risk. And it's the same risks factors: hypertension, diabetes, high cholesterol levels, smokers. It's all the same stuff. It's just that's why I say it's a form of heart disease. So understanding your risk, your family's risk, helps you to try to defray some of that. And a lot of this stuff is preventable. We just don't do it. So if anything impacts I'm telling the truth. Things that impact the brain, you always want to look at what's your vision. If you have a visual change that hits you all of a sudden, like one eye, so you can't see out of an eye, or facial droop, or one side gets numb, that that wasn't the case 5 minutes ago. Speech difficulty. These are things that tell you I need to get evaluated, and you don't want to waste time. The faster you get to the hospital with stroke-like symptoms, they can oftentimes maybe to give you medicine to reverse it. But if you wait too long, so time you see something it's not right, I always tell people, listen, when in doubt, just go, because you don't want to wait, and because the longer you wait, it could become a permanent issue, and you may not reverse itself. But a lot of things can be reversed, and a lot of things can be prevented, and that's really the key. So I think this whole issue today is, how do you prevent disease from happening? Because you can prevent it, and you can if you do the right things. And if you prevent it, then why? To me, that's always the better approach.
All right, I'm going to go to some of these questions now. We were talking about warning signs and symptoms of poor heart health. Now, if I'm with somebody and I'm seeing something, what am I looking for?
So, changes in your clinical condition. Say as example, the biggest thing is chest discomfort, shortness of breath, weakness, fatigue, things outside the norm. Listen, I was tired this morning because I was up most of the night, but it doesn't mean I have a heart issue. It means I'm tired because I was up the night before. Things out of context, though. If you could walk 5 blocks last week, and all of a sudden you can't walk a half a block before you feel like you're huffing and puffing, something's wrong. So any immediate change in symptoms, I think, or change or development of symptoms that you didn't have before, things that are not usual for you, those are your red flags. And you really want to make sure you understand your history. If you have high blood pressure, if you're diabetic, don't mess around with this kind of stuff. Understand it, get it under control, because your risk is going to be higher. So things that change, with your breathing, with your discomfort, weakness, fatigue, palpitations, things like that. Those are the signs that you want to say, okay, if I'm having this, it may not be that you have a heart issue, maybe something else, but you want to get it evaluated.
Someone asked, are restaurants and their supersized portions the real culprit?
You eating it is the real culprit. To be honest with you, that is the real culprit. But nobody can make you eat the stuff. You're making a choice, But I think you want to have a place where you can make the best choices, and I do think that the restaurant business could do a better job, and no question about that. What I would say is this: the choices you decide to make. But yes, I think we all play a part. We all do.
If you had to pick two things, what would be the top two things if you had to make changes today? If someone says, I want to make changes today, what are the top two things you would tell them to do?
If you're overweight, weight, clearly, and then what you eat. I think that and activity. So I want to do three because I think I'm gonna take three because those are your top three things that you can do that really impact. Now, what I want to caveat that by saying this. A lot of people, like I know people that wouldn't get vaccinated because they say, well, I exercise every day. I don't need that stuff. Well, you don't know medicine. Again, you're better off by exercising. No question about that. But vaccines are designed to train your immune system to recognize an infection quicker. And your antibodies are already kind of pre-formulated. That's like your army to fight this other army. So if you have never been exposed to this infection, and you can exercise all you want to, you ain't got no army to fight it other than you're in shape, which is good because that means if you get the infection, you're more likely to survive it, but you don't have the army necessary to fight it, and that's the thing. So you still have to get your checkups. You still have to make sure you do your preventative things because you're better off with the activity, but you're not fully protected. So you have to it has to be a combined approach.
Okay. Someone asked about the foods that are supposed to be good for you. Is high fiber supposed to be the best?
Well, that's, you want lower carbohydrate, higher fiber content because that does have impacts not just for heart, but for other, cancer prevention things. I think the key thing is trying to avoid the ultra-processed foods. Things you get in packages, you have to be extremely careful. One of the things my wife always says, she looks at the labels. How much stuff is in it? How many preservatives, that, all the the dyes they put in stuff, all that can impact. So you want to have the more natural approach to that. And I tell people, don't just do supplements. I think that's going to be the answer to everything because you have to do it as a program. To me, you eat right, live right, do right, you'll get right. But if you kind of say, okay, I'm going to do half this, a lot of that, that's not the way this has to be done. It has to be the entire picture of your activity, your weight, what you eat, how you live, keeping your stress levels down. Has to be the whole picture. And I think you can really make the kind of impact you want to make in terms of prevention if you do that.
Now, when you go to your doctor, should you be asking them to connect you to all the different little things to test your heart?
The EKGs.
Yes.
Well, normally they're supposed to know when you need these types of things. Typically when you get to a certain age range, we'll do that once a year anyway. If you have hypertension, some other risk factor, things that you want to start looking at cardiovascular health. So it depends on your age, other medical conditions, but just routinely no. But I think it just depends. If I have somebody that's 20 years old, who exercises every day, they look fit, that 2% body fat, I'm not worried about their hearts right then unless I hear something crazy or they tell me something that I know I have to be looking out for that. But if I have a 60-year-old who has hypertension, they're diabetic, smoke like a chimney, their father died of a heart attack when he was 40, I'm going to be a lot more on top of that individual because I know their relative risk is 5 times higher. So it just depends on the situation.
Okay. What if somebody doesn't know their family history? What then?
Well, you can't know what you don't know, So I just say I don't think you need to overdo outdo that individual. But what you want to do is, periodically you look. I'll do a routine EKG on people. I may not do it every year. It depends on the individual state. But I look at their other factors. Are they overweight? Do they have these other medical issues we need to look out for? You can't know what you don't know, but you want to look at everything else and be on top of everything else. And you make an assumption to some degree. I'm gonna treat this person as if they have a family history, so I make sure I'm on top of it. Even I may not you put them through 8 million tests, but you want to just treat them as if you don't know, especially if they fall into any other risk categories that you need to be worried about.
Okay. Are you looking at immediate family history,
Yes.
like
Mother,
my children
father.
to me or my children to my mother?
It's
Where
first
do you
degree
go?
relatives.
First degree.
If
Okay.
mother, father, brother, sister.
Oh,
That's
okay.
what you look at. First degree relatives. Grandma Joe don't count. Or whatever, Grandpa Joe, I should say. That doesn't count in terms of what we look at, because what we look at is premature risk, premature family history. It's not just family history. It's important to know if Grandpa had a heart attack and he was 80, but we know the relative risk is high at 80 years old anyway. So that doesn't mean that you are at risk. But if Grandpa had it when he was 40, that suggests that you have a genetic predisposition.
Wow.
So we look at fathers, like I said, men less than 55, women less than 65. That suggests that you have a genetic predisposition. Doesn't mean you'll get it. Just your genetics suggest that you could be at risk.
Keith, thank you so much. We are actually out of time. There's so much for me to think about and things I need to pass on to folks that I love and care about. And
Well, I told you I'm in my element here. So.
you definitely are. And I thank you so much
Not a
for
problem.
sharing your knowledge with us.
The first time ever I saw your face.
We lost another icon in the music industry this week. Singer, songwriter, and pianist Roberta Flack passed away on Monday. Her career spanned decades of showcasing incredible hits like Killing Me Softly and The First Time Ever I Saw Your Face. Her ballads blended different genres, jazz, folk, and R&B. She often collaborated with Donny Hathaway, recording hits like The Closer I Get to You and Where Is the Love. Not only did she frequently top the Billboard charts, she was the first artist to win the Grammy Award for Record of the Year in consecutive years. Roberta Flack was 88. I want to thank you again for spending the past hour of your life with us. We know you have other choices, so we are grateful that you chose Another View for your listening pleasure. You can always find Another View online at whro.org/Another View or Spotify or wherever you find your favorite podcast. Next week on Another View, Congressman Bobby Scott joins us to talk about the chaos in Washington. Well, our theme music is an original composition created especially for Another View by Jay Sennett. A big thanks to Dr. Barry Graham, who took over my producing duties today. Thank you so much. Jordan Christie is our audio engineer, and Neil Johnson answered our phones. I'm Lisa Godley, and Shavonna, thank you so much for helping me today with research. She's an intern, you guys. I'm Lisa Godley. These are stressful times. Figure out what keeps you calm and does not cause harm, and go do it. Let's get together again next Thursday at noon for Another View.
Support comes from Hampton Roads Community Foundation, partnering with donors from all walks of life to improve southeastern Virginia through grants, scholarships, and leadership initiatives. Learn more at hamptonroadscf.org.